Hello and good evening all. Today we are going to take some discussion on some MCQs as well as picture tests that are relevant in your exams. So you pay attention, you take down your questions, okay? Now, the areas we are going to talk on today will cover fluid and electrolyte therapy in a surgical patient, as well as shock, MCQs that are related to shock. Then we'll now talk on some picture tests, okay? So the picture test will actually be on several broader areas that will include both imaging as well as some surgical pathology. Okay, so fluid and electrolyte therapy in a surgical patient, we've had a lecture on that, but today we will just be explaining some of the bases so that when you see that in an MCQ, it's going to be, you'll be very familiar with such questions, okay? So the first question is regarding total body water, okay? Total body water in adult males is about 60% of body weight, and females, 50% in females, okay? B says the intracellular space makes up 30% and extracellular 25%, and intravascular space 6%, interstitial 18%, and transcellular 5%. Now, this question is on total body water. And of course, we said total body water in an adult male, okay, in an adult male is 60%, and that in a female is 50% of body weight. Okay, so total body water in an adult male is 60%, and in adult female is 50%. You should know that it is more in the males because they have more muscle mass. And of course, you know that muscle have more water content than fat, and females have more body fat, okay? So that's why it's higher in the males. So A option is correct. Total body water in adult males is 60%, and that in females is 50%. Now B says the intracellular space makes up 30% and extracellular 25%. Now you should know that the intravascular or the intracellular space, rather, the intracellular space makes up 40% of that total body water. Intracellular space makes up 40% of the total body water. So the intracellular is 40% and extracellular is 20%. That is making 60%. So this second option, B, is false. Intravascular space is 6%. This is false because intravascular space is 5%. Okay, 5% of total body water. Then interstitial space, 18%, which is false. That is 14%. And transcellular 5% is false, which is 1%. So you should know the proper distributions of total body water. It is very important you go through your slides and master the various compartments, because you can be asked in your exams, especially in multiple choice questions, and these values can be played with. They can play with these values, okay? So if they play with the values and you are not very conversant with this value, you might run into trouble in trying to answer such questions. Okay, so we'll now move to the next question. The next question is regarding electrolyte. Okay, regarding electrolyte, potassium is the predominant extracellular cation. Okay, potassium is the predominant extracellular cation. You should know that potassium is the predominant intracellular cation. So A is false. Okay, sodium is the intracellular cation. Okay, that is false. That is extracellular. So these options are interchanged. You should know that potassium is the predominant intracellular cation and sodium is the predominant extracellular cation. Phosphate is the predominant, okay, intracellular anion, okay, which is correct. The most important intracellular anion is phosphate, followed by proteins, okay? So C is a correct option. Chloride is the predominant intracellular anion is false. We said phosphate is the predominant intracellular anion. So D is false. Protein is the predominant extracellular anion. That is false. It is chloride. Okay. So let's move to the next question. Okay, let's continue. Sorry for that little break. Regarding fluid requirements in the tropics, total daily fluid requirements in a surgical patient is 3,500 mils. Total daily insensible loss is 1,700 mils. Total daily urine output is 2,000 mils. Endogenous water production is 500 mils. 50 grams of glucose provided in fluid eliminate gluconeogenesis during starvation. Now, you should know that the fluid requirements of a surgical patient in the tropics differ from the fluid requirements of a surgical patient in a temperate region. Now, note that because the tropics is hotter, the amount of fluid loss is higher, so the requirement is higher in the tropics as compared to the temperate region. Now, remember, total fluid input must be equal to total fluid output so that it's balanced. If you have more input exceeding output, patients will retain fluid.
We are going to